I'll give the spiel on the basic complications, whatever nerve injury, sinus exposure, healing, bleeding, all that stuff pretty quickly, but then asking what questions do you have, right? And giving them the opportunity to see, is this patient really concerned about something? Is there more they want to hit on?
Instead of saying, do you have any questions? And you put them on the spot like that, and they're no. Your natural response is no. You say, what questions do you have? Which makes them kind of think for just a second. Wait, out of everything you just said, well, I did have a question about this, and then you can clear up some of those, worries that they might have. And if they're not worried, they'll say nothing. Most people do, but if they're really worried, that's the time where it'll come out, and you can address some of those things. And I think that builds their trust even more because, like, hey. And I've had, people recently say, they ask that question after you say, what questions do you have? And you answer, you take the time to address their concern. And they're like, you know what? You're a good doctor. And you're like, yeah, you're welcome. No problem. Just doing my part, taking care of you.
Yeah, so kind of changing it from a yes or no question to an open-ended, almost like a free response question that you're inviting, or the answer is more of a detailed sentence you're looking for, as opposed to, because changing it and making it a yes or no question is putting pressure on them to answer quickly, right? And just say no, yes. Like, so we want them, the pressure off, and we want them to say what their concerns are, and talk about it.
Exactly. And the last thing is when you ask the question that way, you're almost implying that they do have a question or that they might, what questions do you have? So if you give them that courtesy, then they feel a little more open to asking.